Handed knot. We have it clipped in the middle, okay, and we're going to tie a two-handed knot. I'm right-handed, so I'm going to put my right hand is going to have the string that's underneath, and you see the X that it's made is crossed. So if you start the strings crossed, you don't have to cross your hands after you tie the knot. Once again, we talk about a C or an L of your non-dominant hand. I'm holding the string with my 3 dependent fingers. And then forehand knot has the string over your forefinger. Backhand knot will have the string over your thumb. So you start with a forehand knot because you have your strings already crossed. Just throw the stitch between your thumb and forefinger, touch your thumb and forefinger together, and this made a loop. Bring your fingers through the loop, grab the stitch, bring your fingers back through the loop as you let go, bring your hand back down, slowly tie the knot, and you see it's a flat knot. That's your first knot. Your second knot, same thing. Got my C, holding with things. I didn't let go of this at all. Now that's the forefinger, that's the first knot. Now the back hand's going to be over the thumb. Same motion. Bring the string in, put your fingers together, then bring it back instead of forward. Hand yourself the stitch, let go, put it through. That's your second knot. See how they're flat and it's locked. Once again, C, forehand knot now, over the forefinger. Bring your string in, close your fingers, lop it through, bring it back, come down. Same place, okay? Notice I never let go of this with my left hand. Never let go. A lot of people just drop it and just keep it there. Loop my thumb under, put it together, bring my hands back for the backward knot, bring it down, drop it out. We're just going to do some quicker ones. So forefinger, forward, back, down, thumb, backhand knot. I basically want to just do this with about 1,000 knots. Okay? That's the simple two-handed knot. We're going to show a demonstration of a simple stitch. I'm going to go through some basics with you, what needle holders are, what stitches are. This is a 2-0 silk stitch, so it's a braided stitch that is non-absorbable, and there are lots of stitches, but the two things you need to know about each stitch is whether it's a braided intertwined stitch versus a monofilament stitch, and you also need to know whether they're absorbable or non-absorbable, and each one will be discussed in your lectures and your handbooks. So a needle holder, okay, when you're first starting with a needle holder, there are people who will tell you to palm the needle holder and never use your hands in those little holes. That takes practice, but I will tell you that when you start, you should probably put the needle holder in your ring finger and your thumb so that you have your index finger ready to give you better control of how you pass the needle driver. Now, when you grab a needle, it's going to come back on the screen. Here it comes. A needle, every needle has a curve. The curve is called the swage. Where you grab the needle on the needle holder is very important. You want to grab it all the way to the tip of the needle holder. You don't want to grab it like this because then the needle holder will get in your way as you're trying to pass your stitch. You want to grab it at least at the midpoint of the curve. That's why we have different sizes of curves and different other issues that will depend on how you have a needle, what your needle point is, what the size of your needle is, what your strength of the metal of the needle is. All those will be assessed. So depending on what stitch you're throwing will tell you which needle to try or to ask for. Then as you grab the needle, you're going to grab it right at the tip, at least in the middle, sometimes behind, usually never before. I always grab it right in the middle, on the start, and then you want to talk about your yaw, or your curve forward or backward. You probably never want to have a backward curve. You want to be straight, or maybe a little bit forward curve, like 10 to 15 degrees there. That will help you with your wrist to make sure you throw a straight stitch. Now, we have a little defect here in the sponge we want to close. So we're going to grab this needle. We're going to put the needle, the string is going to be away from us so it doesn't get in our way. You want to pierce your tissue at a right angle all the time, so I want to bring all my wrist all the way back. Pierce the tissue, then turn. Bring it up through. And then you want to, for safety reasons, you want to try and just gently take your time. You want to be able to try and grab your needle at the midpoint of the curve again, so it's ready to throw. Lock it, pull it out, and take a minute to learn how to just turn it with the needle holder in your wrist. Then you can re-grab with your fingers. Go to the other side again. Enter the tissue at a right angle. I'm underneath now. Come out. There's your stitch. Quickly, we're going to go through tying this knot. I'm going to try and stay out of the way so you can see it. I want to shorten up my string, my needle string. You don't want to bring your needle through your loop. So this, I can't cross my stitch like we talked about previously, just tying the knot. So this way, I'm going to throw a backhand first instead of a forehand. So shorten this up so that it's at a comfortable length, the short one. Let the extra stitch just pass through your hand. Grab the stitch with your 3 non-dominant fingers. There's your C or your L. We're going to start with a backhand stitch, so my backhand is my thumb. Loop it over my thumb, come in, put my fingers together, back through, bring it down, flat knot. Now I got to do the opposite. So the only thing opposite about it is now I start the string on my finger. Come down, grab my fingers together, put it through, come down. Start with thumb again. Put the string through your 2 fingers, press your fingers together, bring them through the loop you just created, hand yourself your stitch in between your fingers, bring it back, bring it down. Start forefinger one more time. Start on your forefinger, bring the stitch through, put your fingers together, bring your knot down, at least 4 to 5. Now you're practicing, you can throw as many as you want. Each stitch will have a designated number of knots. You should plan to throw at least 4 on everything until you get used to. Some will require less. The only ones that require less are probably Vicryl, and silk will require 3 knots. The sutures will require at least 4 knots, and some will require many more, such as monofilament small needles. And then you just keep tying. There's an art to cutting a knot, which will show you get a scissor. And the joke is always, how do you want to cut this too long or too short? Well, if you want to be cool, you want to take your scissor, slide down till you feel the knot. Feel the knot, turn up 15 degrees, just cut. And then you leave a little tail of about 2 to 3 millimeters. That's it.